Good evening, everyone. Welcome to today's live with Dr. Karen. We're just waiting for her to come on. Hello. Oh, that's filling up pretty quickly. Hi, everyone. We're just waiting for Dr. Karen to join us. I hope you're doing well. Okay. Karen, if you're on here, please do send a request so we can go live together. Hi, everyone. That's waving. Okay, there she is. Hopefully that's come through. Accept. Okay. I'm not sure what's happening. I have pressed accept, but it's not seeming to come through. Bear with me, guys. I'm not that technical. Accept. Oh no, it's not going through. I'm not sure why. Accept. Okay. I'm going to try that again. Hello. Hi, everyone. Sorry, Karen, if you're here and you can hear me, would you mind trying to request again? Because I can't seem to accept it on my side. And I'm going to try and invite you. It says you're unable to join. I'm not sure why. Oh, it's come through.
Hi, how are you?
Hi.
Hi.
I'm good. How are you?
I'm good. How are you all?
Yeah, good. It's been a busy day. It's half term.
I know, it's been so busy, really busy. But for me, actually, the kids are away, so it's not been so busy in that respect, but work busy.
Yeah, work busy. Of course. Okay, well, today's live, hello everyone that's joining. Today's live we'll be discussing like conditions and complications that can arise in pregnancy, and we've had a few questions that have come through, and I've tried to summarize them as much as possible. So I'm just going to go ahead. So for time, I'm going to go straight into the first one.
Fantastic.
Oh, actually, no, before we do that, for anyone who lives under a rock and doesn't know who you are,
That's so funny.
would you mind please to introduce yourself to our followers?
Hi, everybody. I'm Karen Joash. I'm a consultant obstetrician and gynaecologist. Been doing this for many years. I've worked in obstetrics for over 23 years, 22 years. I have to do it by my son's age because I had him just before I finished medical school. And I work at Imperial. I work at Queen Charlotte's Hospital. I work at the Lindo Wing, and I work at the Portland Hospital as well. And as you all know, very passionate about women's health and also about the issues that surrounding inequalities in women's health.
Perfect. Thank you so much. An OG in the game. We have to salute, you know, give respect wherever it's due. So thank you. Thank you for all the work you do. You are literally amazing. So I'm going to shoot ahead with my first question. So how do pre-existing medical conditions like fibroids, sickle cell anemia, hypertension, and diabetes impact pregnancy for Black women?
She's not making it easy for me, is she?
I'm not. I'm going straight in. I'm going
three
straight
high-level conditions all at once. Let me see what I can do then.
All of the
Okay,
pre-existing
fibroids.
conditions.
We start with fibroids.
Yeah.
So fibroids, we know, are, and I think everybody knows they can affect fertility. They can be found on the inside and lining the womb, or on the actual wall of the womb. They're like balls of muscle. If they're small, to be honest with you, they don't tend to cause too much of an issue. It's when they're a little bit bigger, they can cause a problem. Or if they're inside the womb, a lot of people don't realise that, for example, if your womb is like that, and inside you've got a ball of a fibroid, that's called a submucosal fibroid, that can cause problems. So it can lead to, people don't actually conceive, or can lead to miscarriage. So we usually would advise for those fibroids to be removed, and the ones on the inside are quite straightforward to remove those.
Okay.
And then when people are pregnant, they can cause lots of pain as well, because the fibroids are stimulated by estrogen. Right. So therefore, obviously we've got lots of lovely estrogen from the placentas when you're pregnant. So it makes those fibroids grow. And in some cases, they grow to the extent that they can cause a lot of pain for mum. They can undergo something called red cell degeneration, which is essentially they outgrow their blood supply, and then the tissue starts to die in the fibroid. It can release a lot of inflammatory markers, not great, and therefore can lead to sort of preterm delivery and preterm labour.
Okay.
And then the last issue is really around deliveries. They can obstruct the birth canal, so people can't deliver normally. They can also lead to what we call postpartum hemorrhage or postpartum heavy blood loss. Because, you know, if you've got a nice womb like that and it needs to shut down when it's finished, with the baby's out, if you've got a ball in the middle of that line, the womb, it can't shut down. So therefore, it can cause postpartum hemorrhage. So that's fibroids. Yeah,
wow.
got that one.
Okay,
What's the next one you asked me about?
I mentioned diabetes, but no, that was actually really helpful, and that was broken down in a very simple way. Because you always hear fibroids, but I think well, I can only speak on my behalf. I know that they affect pregnancy, but that's really detailed and in such a simple way that anyone can understand. So it can affect you basically at every stage. You know, like from fertility right up until you know, labor. So yeah, that's really helpful.
In fact, I think there's some figures that say actually just 4% of the infertility is caused by fibroids alone.
Wow.
So whereas some people used to say, oh, it's fine, leave them, there are some studies showing that actually just with fibroids alone that can lead to infertility. And I think for Black women, it's really important to understand that, to really, you know, if you're thinking about getting pregnant, it's like, should I get the fibroids out or not get fibroids out? I would often say to people to try to get pregnant for 6 months to 12 months. And if it's not working, then think about fibroid removal, because obviously that can be another inflammatory effect on the womb itself.
Yeah, that makes a lot of sense. That's very good. Very good advice. Okay, so the next one is diabetes. How can that impact pregnancy outcomes?
Oh, diabetes. I love diabetes because for me, it's something that is reversible, something that you can take hold of. We can change our lifestyle, diet, nutrition, and make a difference. So essentially what diabetes is imagine we've got our lovely pancreas, which is an organ that sits on our left side near our stomach, and secretes lots of lovely enzymes and also insulin. So when we eat, those get secreted, it mops them all up, and then it allows us to absorb them into our body or store it away. But just imagine if when type 2 diabetes occurs, your pancreas is not efficient. It's not able to release enough insulin to bring the sugar out of the blood and store it away. So therefore the level goes high. So when the level goes high, it attaches to different parts of our organs, including your cardiovascular system, that's your veins. They can make the veins more hard or more prone to high blood pressure. It can therefore affect the veins that go to the kidney, so lead to kidney problems as well.
Wow.
And as we know that if your sugar goes higher and higher and your body can't use it for energy, your body starts to become a bit more acidic. You secrete something called ketones. And therefore, obviously in that in itself will make you very tired, you get very thirsty, and that's type 2 or any form of diabetes essentially. But if we're talking about specifically pregnancy type diabetes, it's in a sense, pregnancy, I call it a fitness test for life. You know, I remember I had a little bit of blood pressure at the end of my second pregnancy. I've got 3 kids. And so therefore it made me think I've got to be switched on about the things that are, you know, are more likely to mean I have blood pressure later in life. And again, you know, if you develop diabetes in pregnancy, it's kind of giving you a warning sign that you can change or do things to guard yourself against getting it a bit later. So in pregnancy, if I roll it back in and now to think about pregnancy and specific effects, it can lead to babies that are too big. So imagine that sugar's not getting mopped up. So it crosses the placenta, goes through the baby, and it is working okay, but then it gets stored as fat cells.
Right, okay.
It can also actually reset the way the baby's metabolism deals with glucose to increase that baby's lifetime risk of diabetes in the future as well, because it's like the signal is altered. It can lead to babies that are too big. So when you want to deliver, imagine you've got more weight around the waist. It's difficult for the shoulders to come out. So a condition called shoulder dystocia. Yeah. And then if you imagine what we talked about, all the metabolic changes with the high sugar level, it can cause stillbirth, unfortunately, as well. So it's very serious. Yeah, very quite serious. Yeah.
So it's very, very, very serious. And you can obviously have that. You can have managed that before. That could have been a condition that you had before, but it can also be induced by pregnancy as well.
and also induced by stress as well. So, you know, when we're talking about Black mothers more likely to have all these conditions that we're talking about, we know that the cortisol is linked to sugar levels.
Right.
And cortisol is our stress hormone, you know, because it's your, cortisol is a hormone that's getting you ready for fight, flight or fright. So all the sugar gets into your bloodstream ready for you to have action against a stress response. So if you continually having lots of microaggression, stress in your life and everyday sort of just living by virtue of being a Black woman in a society that's dominated by yeah, I can hear the heart, see the hearts going up. You will have a higher level of cortisol. That's why when it comes to Black women, there needs to be a lot of self-love, well-being.
Self-care.
To bring that self-care. We love the self-care.
It's not just a buzzword. You actually genuinely need it.
It is a prescription for all of you on the call or who listen to this later. Really important part. So, for example, myself, I've had a really tiring day. I've had a bath when I came out at 5 o'clock. I laid in it with my lavender just to relax and bring down my stress levels. And so when we're thinking about pregnancy diabetes, we know there's pre-existing risk factors. There are our lifestyle factors. We just talked about stress. There's diet. So thinking about eating too many white carbs, things that which aren't good for sort of pregnancy diabetes, and really lack of exercise as well. So we saw a lot of diabetes during COVID because women were just sitting down. They weren't going around doing their usual things. Diabetes went through the roof.
Wow, very interesting. Very interesting, actually. Yeah. And about that self-care, look, I've got my electric blanket on. After this call, I'm jumping in and I'm just gonna lay there. It's like a mug of like hot chocolate just wrapped up in your really bed. Important. But yeah, no, that's super, super serious. And thank you for another great explanation. The next thing on here was sickle cell.
Yeah, so sickle cell, obviously, there's two types of, not really two types of, but you've got to understand the sickle cell anemia, which is full-blown when people have their red blood cells are slightly changed in shape, which means they don't carry oxygen in the same way.
Right.
So when those cells are lacking in oxygen, they do go into a sickle shape, which means they don't pass through the vessels well and they block vessels. And that's what sickle cell crisis is. It's the reduction of oxygen to those limbs or organs, or, you know, in extreme cases, even to the lungs, which can be really fatal.
Okay.
But more Black women are affected by sickle cell trait. That's where just one of them is sickle shape, like myself. So that means they're more prone to be anemic in pregnancy, and they need to be very much aware of how this impacts and affects them. And then some people can have what we call an HBC trait. So it's not sickle cell as two S's, but one is a C trait and one is a S, and that in itself also manifests as sickle cell anemia.
Okay.
It's a very serious
condition. What does HBC stand for?
HBC is a variant of hemoglobin, which is just C hemoglobin.
Okay.
So essentially, these are really serious conditions, and unfortunately, people don't realise that not all hospitals are experts in dealing with them.
So true.
So therefore, some people get substandard care, and we know in some of the maternal mortality reports, women weren't given basic things like oxygen, pain relief, kept warm, and all these are things to promote the oxygen to come into the vessels to help reduce the sickling crisis that's occurring in the vessels when the obviously the cells are lacking in oxygen. But, you know, I've definitely, you know, even as a junior doctor, I've worked in hospitals where I was the person who knew the most about sickle cell anemia than the consultants and people around. So it's unfortunately not everybody realises that. So it's important that if somebody's pregnant, that they seek, even if you have to travel an hour or two to get your advice, those are the hospitals that you need to know to go to. And they're normally the ones that have a tertiary specialist haematology unit attached. But as you've been involved in the maternal medicine networks, haven't you?
We're involved in so many. I'll have to.
Yeah. So
yeah, I think so.
So there's now a national decision to have what we call maternal medicine networks, which are across the whole of London, which essentially you get your specialist care and provision from those.
Right. Is I believe is St Thomas part of that?
Yeah, St Thomas is.
Yeah. I know. Yes. Exactly. I know. Yeah, I know exactly what you're talking about. So, do you know what it is? We're involved across so many things. I was like, is it that one? Yeah. That's really good. No, that's really, really good. And I think a point that you mentioned is really important to pick up on is the fact that it is important to travel Like
Yes.
if your hospital around you, if they don't know like how to properly care for it, you need it done by a specialist team, even if it means you have to travel. It is really, really important, because what you don't want to do is go to a hospital and they're like, well, we don't even know what sickle cell
Yeah.
is. You know, that could be potentially quite dangerous. So going out and seeking out that specialist help, and I'm sure there are specialist pathways if you do become pregnant and you have sickle cell trait on, and the other things that you mentioned, right?
Yeah, definitely. And you've got the Tommy's charity as well that have now got the midwife that you can call for help
Yeah.
or advice.
Yeah.
So that's also a really good resource to
Really,
use.
really good one. Okay, so you've kind of answered the two questions in one, which is really good. Because my next one was, what can Black women do to manage their pre-existing conditions before and during pregnancy? And how can healthcare providers support them with that?
So really it's about pre-pregnancy counselling. So if you've got any condition like we've discussed, or any other medical condition, you do actually have the right to have a pre-pregnancy counselling appointment with an expert in the hospital to really sort of map out your care and how best to deal with it. Now, just be aware, and you know, I look at us as Black women, we're into holistic medicine and other natural things, which is really good. But oftentimes the doctors aren't very much aware of that, because we're not trained in that. We're trained in medicine mainly. We're not all usually trained in nutrition and exercise as well, which is a great sort of love of mine. So you will get some really good sort of advice about your medical condition and what to do. But when it comes to general lifestyle advice, you'll have to look a little bit further afield. And as you know, I've got a company called Pure Mama, and that's what we're focused on. We're focused on lifestyle nutrition to give people a little bit more support about things that they can do to maximize their health before pregnancy. And I always think of it as a triad, you know, a triangle of things that you must do. One, you must really think about your diet. You know, and it's not to this extent. I always say to people, you don't have to cut out everything. You know, there's things that we're made to enjoy. They taste nice, so you put them on. That's why you put them in your mouth.
The pounded jam, the pounded
jam, the plantain. I don't care. You know, my kids keep telling me, you know how many calories in plantain chips, mummy? You know, we're looking at certain things. So you give yourself treat days where you eat as you would freely want to eat. But then other days you modify your diet, making sure you've got lots of fresh vegetables and fruit. And naturally, actually, most cultural diets have got really good things. We've got spinach, you know, the almonds with the agusis, really, really good. Peanut soups, curries. They're all very rich and very wholesome and healthy. But then sometimes we just think about the carbs we put on with it. So we're having pounded jam. Rather than having a whole portion, you would have a quarter of a portion or a half. If you're having your plantain, you'll cut it down. And so that it means that you're modifying. And if you, rather than deep frying, you use the air fryer. All of these things are really big sort of wins that make a big difference to your health for afterwards.
You gotta have air fryer. I'm an advocate for air fryer, honestly. Like whoever, I think the brand that I have the air fryer with, they need to sponsor me, because I use it every single day. Every day. It's just, well, not only are things done quicker, but they're way healthier than deep frying and all of this kind of stuff. Like air fried chicken, don't even play. Don't play with me. But yeah, no, it's so true. I think it's just making those slight tweaks and those slight adjustments will make a very big difference along the way, as we have obviously spoken about before. So yeah, really important.
And then when you think about breakfast, think about cereals are not great for you or for your kids. So think about other wholesome foods like, you know, your porridge, even Tom Brown. I don't know if anybody's familiar with Tom Brown. Do you know what that is? So that's just like ground peanuts and other nuts that are put together. And you just add milk to it. It's a traditional African porridge. And even, you know, there are other things like that that are quite healthy. You have that, start that off, you know, within a day, add your berries to it. And then, you know, for lunchtime, have a lovely, you can have a salad. If you don't want salad, you can have a portion of rice together with your favorite protein or meat. Rice being a quarter, vegetables being, you know, at least two-thirds, and the protein being another two-thirds. Because if you increase your protein or your meat, that actually manages your hunger more than you eat in the carbs. The carbs, what they will do, make the insulin spike up, and then it drops down again. Then it crashes again. And then exercise, start slowly. It doesn't have to be, you know, running. You know, women are not necessarily made to have traumatic cardiovascular exercises. So strength training, muscles must be built up, because if your muscles are built up, naturally they absorb more energy, and your metabolic rate will naturally be lower. And it's actually easy to do strength exercises. You know, for example, me, I usually do maybe 20 squats a day, and then just try and do some sort of press ups against the wall. That's to maintain your upper muscles here and also your glutes and thighs. But you can get some more arm weights and do that, and that alone can make a massive difference to your metabolic rate. And what you're trying to do is drive that up slowly.
Yeah, no, that's really good. And your knees must be great for that, because I
No,
can't squat to
I
save
will
my
tell you
life.
the secret. My knees were terrible. I'm the creakiest knees ever. But I took my daughter to go and get checked for physio because she does football and running and stuff.
Yeah.
And I said, "Oh, do you mind scanning my knees?" When he scanned it, I said, "I've got clicky knees. My knees are awful. I can't run. I can't do anything." And then he scanned my knees and he said, "Oh, they're fine. Most knees click. It's just a physiological thing."
Right, right.
And it's interesting. My mind then just reset. My mind re-clicked. Oh my gosh! I started doing squats, and actually my knees don't click anymore. And I've even actually managed to do little runs.
Oh.
I'm not, yeah, like run. I do interval running though. I'm not a fan of a burning chest, so I will do an interval run with a dog. And the day when a mummy was walking past with the son, going, "Oh, be careful, the runner's coming." I was like, "Me, a
Me?
runner?"
You're like, me?
I'll never be a runner.
No, it's true.
Yeah.
It's good. It's these little things. It's the little things that make a massive difference. So
Definitely.
it's good to make sure that we are trying to like manage the pre-existing conditions so they don't manifest into huge things whilst you're pregnant. Okay, perfect. So we've spoken about like pre-existing conditions, and what about some conditions that actually can come whilst you're pregnant? For example, preeclampsia. Now, that's something that I personally have experienced in my first pregnancy. It's almost, I wouldn't even say it came out of nowhere. Obviously the end bit and the reason why, you know, like we ended up starting 5 times more. The whole experience was like terrible. But I had protein in my urine from about midway, high blood pressure from midway, but for some reason it just wasn't picked up by the health professionals, and I saw someone different every time. But anyways, these things, there was little signs here and there that no one kind of put together. So like, can we talk through preeclampsia, what it is, what it means, how it can affect you and baby, and how people can kind of, I know it's as simple as an aspirin tablet, right, to manage it, but how serious can it get?
So preeclampsia is actually a really, really serious condition. And what it is, it's almost as if you're pregnant, and the way your body's trying to pump blood through the placenta, think of it that way, is making the blood pressure change. Because we're trying to perfuse that placenta. And what happens if you think in those conditions, it's almost like the placenta ages quicker. So as we get older, we know about blood pressure in our cells, and we know it's about aging of our veins, and therefore blood pressure rises. Think of it as the same thing with preeclampsia. So it happens in some people, not everybody. And it can be different from pregnancy to pregnancy, but more likely, if it's going to occur, it's normally in the first pregnancy.
Right.
So essentially what can happen, the reason why you get the protein is because the pressure is high going through the kidneys. So the kidneys that would normally filter and hold onto the protein, they become a bit more leaky because of the pressure, and then they let the protein out.
Right.
The placenta itself can get affected because it's older, so it's not supplying the blood through to the baby because it's having to force, your body's trying to force the blood through it. So therefore the baby doesn't receive all the nutrients it needs, so then babies can be smaller. The other thing is that because the placenta's become a bit older, it doesn't really attach as well, or because the blood pressure is so high, it can almost cause the placenta to lift off and cause a condition called placental abruption, where people bleed, and actually, unfortunately, it's a very critical, urgent emergency with a really hard tummy, and babies can die very suddenly. And then you can get the other pressure effects, so on the liver, so that's where people get vomiting and nausea, and you can get the last effects, which really are on the brain with a pounding headache because the pressure is so high in the brain, and that then can affect the optic nerve and cause visual disturbances.
Right.
And so the swelling that we all know about is coming because you haven't got enough protein in the body, so it's leaking out. And protein holds on to, keeps the fluid in the veins, essentially. Right. And if it's low, and that's when you get the swollen hands, swollen feet, and so forth. So that's preeclampsia. So in a very worst case scenario, if the pressure's high, it can cause strokes in mum. It can cause fits in mum as well. So it's really, really important for it to be checked. And people think it's just when you're pregnant, but it can occur up to the month after pregnancy, up to 6 weeks. It can occur very suddenly. So if you're feeling very unwell after pregnancy with headaches or swelling, you need to be seen, you know, and need to be taken seriously as well.
That's really
And with anybody, you know, anybody who's got any risk factors or has had a high blood pressure reading, I would advise buying a blood pressure monitor. You know,
yeah.
don't buy your coffee or whatever you normally buy. Spend £20 to get a blood pressure monitor from the pharmacy,
Yeah.
just to check yourself, and it should really be below 140/90.
Yeah. Yeah. That's really important to note, that it's not just during pregnancy, it can be after as
Yes,
well.
definitely.
Yeah. Yeah.
Yeah.
That's a really good point.
And the other
Okay.
thing is just to recognise the long-term effects. So people think it's just pregnancy and it's over and done with. But with the protein in the urine, it's really important to keep checking your kidney function, making sure that's healthy and it's okay. Check your vitamin D. Vitamin D, which is low, is a major risk factor for pregnancy, diabetes, general diabetes, and also blood pressure. Also make sure things like your diet contain good omega-3s, which are what we call antioxidant, help guard the placenta, vitamin C, vitamin E. You know, all of these are things which are implicated in placental growth and having a healthy placenta. Things we talk about at Pura Mama, which are like choline, pregnancy, you know, all the collagens. We devise that specifically, recognizing it makes a difference.
It does.
For the health of the placenta.
Yeah, it does. It really does. It really does. And it's important that we know about all of the different supplements and things that you can take to make sure you're getting the right nutrients in your body. So don't forget choline.
Yes, they're absolutely right. I'm so passionate about choline. And it's, you know, it's interesting. I saw another article about it, talking about how it's implicated in preterm labour and also preeclampsia, because it's felt to impact on how the placenta grows.
Right.
It's also really vital for our baby's brain health, you know, throughout, from long-term cognitive function. It's to do with the development of an area called the hippocampus at the back of the brain, which deals with long-term memory and also cognitive speed, processing, also implicated in some forms of autism as well, and also dementia, brain health for mum, mood for mum as well, anxiety, depression. And unfortunately, we're finding out, a bit like vitamin D, we're a bit late to the game. We're probably about 75% of us are deficient in it. So everybody, please get your choline.
Choline. Okay, perfect. Can't forget about the choline. Okay, cool. So again, you've answered the next question I was going to ask, was which are the most effective ways to prevent, diagnose, and treat these conditions in Black women?
Yeah.
And what kind of follow-up care is needed postpartum?
So you are, thank you so much for bringing that up, because the thing is that you get your pregnancy, you have your baby, you think, okay,
I'm done now.
I'm done, I've just scraped through. But anything that you've noticed within your life is, I think, a little treasure or a nugget for you to watch, what you need to watch for the rest of your life to maintain health. So, for example, with me, I had a bad back. I ended up actually slipping a disc after my son. I had an ambulance in bed for the whole thing. And so my back has given me issues my whole life. And you know, later on, I realized that it was triggered by vitamin D problems.
Right.
But I had to get, you know, a physio stroke personal trainer to really strengthen up my core. And anybody who knows me knows that I, you know, chronic back sufferer, I think I'm pretty severe. But, you know, it's something that I've watched, and I'm better now for it as I get into my menopause or 8 years. I've strengthened up my core and my back. So actually, I'm having less problems now than I did before. And I've learned the use of things like for joint health, like collagen and so forth. When it comes to the blood pressure, I was even put on blood pressure tablets, you know, later in life, but I found it was really a bit tricky for me. So I had to do a bit of research. I had to lower my weight a bit. I was definitely putting on weight, probably more than what I would usually do. I had to rethink my food habits. And I also started taking things like magnesium and beetroot, and also relaxing more. So really using techniques like mindfulness, which is just deep breathing, activating your phrenic nerve to reduce your stress levels. So I had to learn how to do that, and I could see, you know, the changes. I've got an Apple Watch as well. That was that's a gift from somebody, but that made a big difference for me. And on there, it's got something called the VO2 Max. I don't know if you've heard of that before.
No, I don't think I have that on mine.
You do. Everybody has it, but they don't know what it means. So it's different from looking at your oxygen levels. It's telling you where you fall in terms of your fitness level and how much oxygen goes through your body as you walk or you do other things. So it's your VO2 max. So athletes use it as a test of fitness.
Okay.
Yeah. So have a look at that on your watch. It you know, for me, it gives me so much information. I can tell, like, if I've just had a cold or I'm a bit ill, You know, once I used to be in the above average, and then I was average, and then getting lower. Like, Karen, you need to go on those walks again and get your exercise up again. But all that is, and that it gives you an explanation of why you see some people who look so fit and fantastic, unfortunately, that end up with heart attacks and other
Oh my
problems.
gosh.
It's because their VO2 max is not necessarily where it should be.
Could be.
So when you're doing exercise, it's not about running for an
Yeah.
hour and non-stop. It's about really finding exercise that raise your
Utilizing.
heart rate.
Yeah.
So you can do a really effective exercise for 10 minutes that will have a far greater reach on your cardiovascular health than running for 1 hour in a small jog. So I would tend to say you hit exercises, but then just for 1 minute, you're almost like really, really pushing it. And when we say pushing it, all they can be simply doing is doing a skip, you know, or up and a down and up and a down for 1 minute. Really, is really fantastic for cardiovascular function as well. So it's about smart exercise, and maybe we can do another Insta live later about exercise. We're going to talk about that all day
You're
as well,
clearly
and
an
about
expert in
nutrition.
this.
Yeah,
You can
and
tell
about,
us how to use our Apple Watches
oh
effectively,
yes,
because I thought
much
I knew
better.
all about the Apple Watch, but clearly not.
No,
This is something I have to
no,
look into. So
definitely.
VO2 max, but also widely, or just more talking about how to exercise effectively and making sure we're getting our heart pumping and to the optimum level, I guess, so that you are making use of it and not just exercising for the fun of it.
Yeah.
You know?
And then think about it. You've got that beautiful child to remind you of what you did and you accomplished. So when they have their birthday, you have your health check. Whether it's the blood pressure, whether it's your blood sugar level, whatever it is, you have your health check. You know,
and regularly. Yeah, you're right. Regularly. Blood tests, all of it. It's really important to get that done. So I remember, like, I just wasn't feeling well. Just, you know, just personal kind of so you guys can relate to this. I wasn't feeling too good. Just overall, a couple of months ago, I was like, oh, there's too many changes in my body. I'm not too sure what's going on. I can't remember the last time I had a blood test. I think it's probably when I had Eden, which was like 2020, and I went and I asked my GP, look, would it be all right if I had a blood test? Can I also get a smear test while you're at it? Because I haven't had one of those in like 6-7 years. And then so much information came back from the blood test, and now we're my iron levels are really, really, really low. My vitamin D really, really low. So all of these things that I just thought, oh my God, I'm just really tired. It's actually all of these things that you were talking about, you know, vitamin D, these things these supplements that we should be taking and the medicines we should be taking.
And also the other thing, we'll add in vitamin D, and you just remind me also, because you said the iron, vitamin D is your precursor for serotonin. So if you're low in vitamin D, you're more likely to affect your mood, your brain function, how you function overall. Iron also is implicated in depression as well, and low energy. So all these things that sometimes we're like, oh, this life, you're feeling it can just be a simple,
it's overwhelming.
Like that.
It might just be, you know, you need to go and get your blood levels checked and see what's going on there, because it might be low iron, you know. And now I've been on those iron tablets for a while. I'm seeing my moods pick back up. I'm seeing like really good positive changes. And that was it basically. But Ropa Zimba has asked a really good question in here, and hopefully you can answer this. What kind of tests should I request from the doctors if I don't have a specific problem?
So generally, as a good rule of thumb, is to check your liver, your kidney function, and your hemoglobin, vitamin D, and also thyroid function as well. I think those are the good sort of basic ones. Anyway, as a supplement, I would advise for anybody, if you're living within, you know, a place where there's not much sun, and even when there is sun, with vitamin D, a minimum of 1,000, but probably optimal at 2,000 a day. I was very, very low in vitamin D, and it affected me. I was getting muscle cramps and all sorts of things, chest pains, and it's actually just vitamin D deficiency. You should also consider about taking magnesium. A lot of people are magnesium deficient, and that can deal with muscle cramps. Spasms is also important as a cofactor in terms of the way that your muscles work and other absorptions into the body. And probiotics, I'm a big fan of gut health. So one day we'll do a really good Insta about gut health and probiotics.
Yes.
So do you know that your serotonin is made in your gut interface? Do you know, for example, if people are overweight and struggling with a metabolic syndrome such as PCOS and all the other things, a simple probiotic can actually revert a huge proportion of those, because the bacteria define what we absorb, you know, in terms of our foods. So we are, you know, I'm very passionate about a lot of my lifestyle medicine, and a lot of doctors have actually changed the way that they treat the patients. to really give them information to actually have big wins through little, changes can make a big difference.
That's
And as
amazing.
you know, I love my high dose beetroot as well, don't
Yeah.
you? I love that high dose beetroot works for diabetes
Yeah.
and blood pressure, as well as energy and iron, and it even works for people with period pains as well. But it needs to be in capsules.
Yeah.
I love my high dose beetroot.
Yeah. No, that's really, really helpful. And so you can just go to the GP and just request for these tests, can't you?
Yeah, you can do, definitely.
Yeah. Without there being anything specifically wrong.
No, you can go
Yeah.
to them and, oh yeah, I mean, obviously they'll normally do NHS. NHS is a bit difficult, but if you can explain that you've got a risk factor in your family or this, you would just want a health check, and over the age of 40, you're entitled to a health check as well.
Perfect.
And definitely, once you get to over 50, definitely you need to get your mammograms in, your smears.
Yeah.
Really, really important.
Very important. Oh, and prebiotics as well. So
Yeah.
there's pro and then there's pre for gut health. I'm really into gut
You
health at the
are
moment because I'm
good.
like,
So what is a prebiotic? Lots of people don't realise. So your prebiotics are all the fantastic things we tell you to eat, like ginger, soluble fibre, your fruit and veg.
Yeah.
Basically, they feed the healthy bacteria. And if you haven't got the healthy bacteria, you won't have good immune health and so forth. So it's not just about taking a probiotic or drinking a bit of Actimel. You need a high dose, 20 billion probiotic can make a massive difference. Yeah.
It really, really, it's really, really good in terms of, what are things that you can do to help get your health as optimum level as possible. Hopefully you can incorporate all of these things and start to see a difference. So the question we just answered was follow-up care and postpartum. So hopefully whoever's listening in or knows anyone that's just had a baby, get them to come and listen back to this for later on. So my last question, and please do, if you've got any questions in here, please put them in the question box or in the chat. I'm reading them. How can Black women advocate for themselves if they feel like their symptoms are not being taken seriously or are being dismissed by healthcare providers? So obviously it's a massive thing in terms of what we campaign for, but from a doctor's, health professional's point of view, what does that look like to you?
So you can essentially, there's ways to do it. So either you're thinking about the health professional in front of you and how you converse with them. You can say to them, I am concerned, and you tell them what I am concerned about. I'm concerned about preeclampsia, I'm concerned about gestational diabetes, and I would like a test. And they can't deny you with that, unless, there's no way they can deny you. However, if they do deny you, there is a system within the hospital called PALS, P-A-L-S, where you can go to and lodge a complaint, and they have to respond to that complaint urgently. And obviously that's a 9 to 5 system. The other two things that you can do outside of your hospital is phone a charity like the Tommy's charity, or you can actually go to another hospital. I know it's a very, it's unusual to say, I'm worried, I think I've got blood pressure, and they're not listening to me at the other hospital. You have a right to have your care at any hospital.
Yeah.
People don't know that. You can go online, fill in the antenatal self-referral form, and it will, and it will be accepted. And then also know the hospitals that have got strategies to really help women from your sort of background. So some hospitals offer extra scans. Some hospitals don't offer extra scans. So, for example, if you feel your baby's not moving and you're worried about it, you don't feel safe in that care, say to them, I don't feel my baby's moving, I don't feel safe in your care, I don't feel reassured by your care. And it's just very simple to say that, simple. Sometimes health professionals get worried when they see you writing things down, but it does make them be a bit more on alert, though, because they think, oh, she's writing down, what's going to happen here? So they actually can become a little bit, they might not think straight, that's what I will say. So it's also being mindful that you, unfortunately, sometimes need to facilitate them to also do the right thing. Having said that, I have had lots of instances. I was talking to somebody about this. I've had so many instances with healthcare, right from being a child with different conditions I've had, and my sister and and so forth. And I would say I am quite a mouthy person now because I've had quite a few issues. So, but I will, never raise your voice. Just say, even if they say, oh, you're being aggressive, you just lower your voice and say, that's not my intention. I'm not being aggressive at all. I'm just clearly stating how I feel. And that's one thing. Because you will feel a bit agitated if you're having to almost advocate for yourself. So lowering your voice and speaking very slowly and just very quietly can often get people to see your point, but also won't allow them to misconstrue and say that you're an aggressive person.
Aggressive.
So
Yeah,
yeah,
because
because
we
we
all
know
know
that
what
that's
the
an important,
stereotypes are of the
yeah,
angry black
that's a
woman.
stereotype,
Yeah, yeah.
definitely.
Okay,
Um,
that's really
and
helpful.
if you've got any more problems, just DM me. I'll come and deal with them.
You heard it here first. Just DM Karen and she'll be on her way. No, but it's true. It's true. And we laugh now, but actually it's a really serious thing. I think a lot of people do get a bit like, oh, you know, I feel like I'm not being listened to. So there's some really good practical things you can do. Because yeah, oftentimes, sometimes it is the fact that, you know, maybe hospitals are overstretched or overworked or whatever it may be, you know, and you feel like your advocacy is kind of not really going far. You feel like, whatever I'm trying to say is just not working. So it's good to have those things in your back pocket, you know, those strategies in your back pocket to say, actually, I might just go and seek a second opinion. I might just go to another hospital. I'm start writing things down. These are literally part of our steps. So if you haven't watched the video or from Monday, we talk about all these things like seeking a second opinion and all of that kind of thing. It's really important. And point them to the 5 Times More website as well.
Definitely, no, most definitely,
that'll you know, help them to see that it's not just something you're concerned about, it's a real thing. I see that the question here, does slightly increased BP values preeclampsia a risk factor for preeclampsia?
It is.
Yeah.
So if that's the case, so the other thing that you talked about at the beginning was aspirin.
Yes.
So aspirin, you can only there's a very clear guidance from NICE where you'll fall into different categories where you should be offered aspirin. So aspirin works like what we call an antioxidant, which means that it guards against placental aging because it stops the something called free radicals. It's not simply about blood flow, which is what people think it is. So if your placenta is not aging, therefore you're less likely to get the blood pressure issues. And so there is it's in actually most handheld maternity notes. There should be a little chart that tells you, do I need aspirin in pregnancy? And you should be able to Google that on the Tommy's website. 5 Times More will have information as well, and it will alert you to if you need to consider taking it. But that's a good way and a really, really important thing you should know about in any high-risk condition.
Yeah, absolutely. Thank you for that. I can see there are no more questions in the chat, and you've been brilliant because you've answered 2 in 1. You've done it. As you've answered the question so brilliantly, you've answered 2 in 1. So actually, we have come to the end of this live, but it has been brilliant. Thank you so much for your time. Thank you for going through these questions in terms of pre-existing conditions, what you can do to advocate for yourself, postnatal care as well. I will be saving this live, so if you feel like somebody else can benefit from watching it, if you want to watch it back and take more notes, you can do so, definitely. But thank you so much. And Karen, please let them know where they can find you and Pure Mama and everything else.
So I'll put the Pure Mama into the comments as well, just so that you know exactly how it's spelled. Yeah, there you go. And let me just actually maybe do it that way. But you can obviously DM me as well. It is a bit difficult, I must say, sometimes because but I will get back to you.
I know the feeling. But eventually. Thank you so much, Karen, and thank you to everybody who has joined and participated today.
Okay, thank
Have
you.
a good
Bless
evening.
you all. Bye.
Bye.
Bye.